Okay, everyone, welcome back. Hopefully you have caffeinated. This time of the afternoon for me is a very tough one. So first, I'm Greg Feero. It's nice to meet all of you. Some of you I know, some of you I don't. First, as a housekeeping issue, on your seats, you will see a pink piece of paper. I think this is pink. Maybe it's orange in some people's cases. If you could, fill out this survey and leave it with the folks at the back. I assume they'll be collecting them before you leave, about the event today. So I thought, to start out this particular session, I would try to engender a little controversy to perk people up a bit at this time of the day. So how many people in the room are familiar with the term genetic exceptionalism? Raise your hands. Fair percentage. So I'll ask you the question. In doing this today, are we engaging in genetic exceptionalism? And to what extent are we engaging in genetic exceptionalism? And is it a valuable exercise? How about, okay, so genetic exceptionalism is basically the concept that somehow genetic and genomic information in the context of healthcare is qualitatively different than a lot of other health information in terms of how it's applied and the consequences of its application. And because of that qualitative difference, it should be handled and thought about differently than perhaps a Chem 20 panel, for example, or a CT scan of your head. Okay, and you could think about that in terms of new technologies as well, a new PET scanner that happens to do something extra special versus a genomic application. So how many people here think that this is a sort of an exercise in genetic exceptionalism, like it's probably a little over the top? Fair enough. I wouldn't think in this room that many people would raise their hands, but I suspect that out there in the community, there are people who feel a bit that way, that this may be over the top. And not to be pejorative towards any one medical discipline, but I suspect, for example, perhaps the radiologists don't spend as much time worrying about PET scanners and their implications for health disparities. I'd argue, though, that I think there is reason to treat this technology a bit differently with regard to health disparities. So at a fundamental level, I think there's a moral imperative to ensure that there are not healthcare disparities arising from this technology that as it comes into play. Why it is different perhaps than other technology, I think, is twofold. One is that it covers such an incredible amount of waterfront in healthcare. So it's not limited to one particular disease. There's reproductive health, there's cancer, there's adult onset condition, there's pediatric disorders. It covers the waterfront. And as a genomics and precision health community, we're essentially, at this point in time, beginning to ask the question of whether or not our whole health system should be revised to integrate this information in a systematic way to move from sort of average-based care or mean-based care coming out of the concept of an RCT to a more individualized approach to care. And I think we just fundamentally, if we're asking that, we have to make sure we're doing a better job of carrying all parts of society sort of along with the ride. So I think that's one aspect. I think the other aspect that is really important when you're talking about underserved populations, particularly less financially resourced populations, is the disproportional effect on not only the individual when there's disparities in access to proven services, but on the systems and the family systems that are involved. The conditions we've been talking about today are devastating no matter what context or what family they occur in. Cancer, inborn errors of metabolism, et cetera, et cetera. But the consequences of needless and preventable disease in a highly affluent, well-resourced family versus family systems that are less well-resourced is tremendous. And so I think it's really, in that sense, I think there is a bit of a genetic imperative. It's not only important to the individual, it's important to the family, and it's generationally important that we get this right for less resourced populations. So this particular session, I think, begins to look at more of the sort of models we can use to ensure that there is less of a gap in access to proven services. And hopefully with this session, you will begin to generate ideas that can come forward in the last session of the day, where we really talk about particularly next steps.